In this video, we will be discussing some of the cornerstones of diagnoses and assessment. So we'll talk about, well, what is diagnosis? What is the process in which a psychologist diagnoses somebody dealing with a psychological disorder? We'll also talk about psychological assessment, as well as a little bit of neurobiological assessment. And we need to understand how diversity comes into play. The diagnosis process, the clinical professional will rely on the DSM-5. And you see right here on the second item, I said it's currently based upon the DSM-5 TR. TR means text revision. The 5 means the 5th edition. So that's the Diagnostic Statistical Manual, Volume 5. The text has been revised. So what are some of the advantages of a diagnosis? It's a good first step in good clinical care that allows the clinician to describe some of the causes and treatment of the disorder. It helps facilitate communication between the professionals, and it advances research for the causes and treatments of the psychological disorders. Now, the Diagnostic Statistical Manual of the American Psychiatric Association is the DSM-5 TR. The current edition is the 5th edition. The text has been revised. That was released in 2022. So some general information about the DSM-5 TR is for each psychological disorder, the DSM-5 manual provides diagnostic criteria for the diagnosis, and the criteria have become much more detailed and concrete over time. And the DSM-5 also provides description of associated features according to laboratory findings and results from physical exams. It gives a summary of the current research literature in the field. And the way it's organized is it organizes diagnoses based on symptoms versus the causes. So it defines the diagnoses on the basis of the symptoms. Our knowledge base is not yet strong enough to organize diagnoses around etiology or the causes of the disorders. So right now, psychologists, they are just focusing on basically the symptoms, not the causes. But that is a work in progress. There are ethnic and cultural considerations in diagnosis, and some of those might be psychological disorders. We need to keep in mind, as it says here, they are not universal. They're not universally applicable to everyone. But one's culture can influence, like some of the risk factors, the symptom experience, certain stigmas, and willingness to seek help in the first place, and availability of treatments. So the DSM-5 TR tries to be culturally sensitive. It discusses culture-related issues for most disorders. It has cultural formation interview questions for clinicians and description of how syndromes present across various cultures. So cultural differences, psychologists have found that they're not always what one would expect. And so we will talk about those coming up, and the DSM-5 TR appendix describes about 9 syndromes observed in specific regions or cultures. In some branches of psychology, they like to use a cross-cultural approach, identify broad symptoms or syndromes that can be identified across the cultures. And the culture-specific approach that identifies cultural concepts of distress that are key in understanding certain disorders. Here we are discussing the statistical analysis of diagnoses by country. So just providing this for those of you who are curious for further insight, how each country and each region of might deal with have certain diagnoses attributed to them. So as we are talking about the Diagnostic Statistical Manual, some, have criticized it, and they say there are just too many diagnoses in this manual. So the number of diagnoses, it continues to increase, and that's because the field is evolving. This term below here, it says comorbidity, and that means that is a second diagnosis that usually accompanies the first diagnosis. Now that might be a little challenging because some symptoms appear in more than one diagnostic category in the DSM-5. So it's really hard to claim comorbidity if that's the case, because some of those symptoms appear in many diagnostic categories. Another criticism of the DSM says there are many risk factors that increase the risk for multiple disorders. Extending just a little bit our discussion about criticisms of the DSM, some say that there are categorical versus dimensional classifications. So a categorical classification is, here's some questions like, do the symptoms fit the category or not? And dimensional classification, on the other hand, that's the degree of an entity that is present. In effect, the severity. On this slide, we will talk about some of the general criticisms of diagnosing psychological disorders. The first states that diagnosis might contribute to stigma or discrimination. But, however, research suggests that people tend to view behaviors negatively more than the category labels. So it's a certain behavior, the specific behavior, that is most seen in a negative fashion. And so sometimes labels may relieve stigma by providing an explanation for the symptomatic behavior. We want to be careful when we are diagnosing. We don't want to lose sight of the uniqueness of that person. So the person's first language, there might be cultural things to consider. For example, a person with schizophrenia, and in the psychological session interview, we want to also talk about, well, in the interview, assessing psychological disorders, we want to make sure that we include a good clinical interview requiring great skills. So importance of establishing a rapport between the psychologist and the patient or the person seeking assistance. The professional needs to empathize with the client and encourage the client to speak freely or elaborate on the concerns that they might have. So we're going to talk about structured and unstructured interviews. We'll start with structured interviews. That refers to when a person's response to one question determines the next question that is asked in the interview. The questions contain detailed instructions to the interviewer concerning when and how to probe in detail and when to go on to questions about another diagnosis. And in addition to the structured interviews, most clinicians, we need to keep in mind in clinical practice, they assess DSM symptoms in an informal, unstructured manner. Okay, so one thing that clinicians need to be constantly aware of is stress is very central to nearly all psychological disorders. So it's clearly important to measure it, but that might be very challenging. To understand the role of stress, we must first be able to define and measure it. That's not as simple as one might assume. The following is an example of a current personality test. Okay, and then the clinician might also use cognitive and neurophysiological or neuropsychological tests. So things like intelligence tests, they assess current cognitive ability in the individual, used to predict things like school performance, diagnose learning disabilities or intellectual ability, and included in neuropsychological examinations. So contemporary psychology says that is highly reliable and has good validity. Only a small part of um, only a small part of school performance. There's much more to it. In regard to neuropsychological tests, they tend to pinpoint specific areas of cognitive functioning impairment. They're based on the idea that different aspects of cognitive functioning are tied to different parts of the brain. So they can give clues as to where in the brain damage may have occurred, and that can usually be followed up with brain imaging techniques. And they help to detect brain dysfunction and reveal performance deficits. And as I mentioned a little bit before, I've mentioned the term self-report questionnaires, and they can be used to assess a person's perception of a situation. It's based on the assumption that the same event can be perceived differently by different people. And those are used to help develop treatment plans. And it's kind of similar to personality tests, basically how they are interpreting the events of their scenario. This is a graph of all the different things that I mentioned, like clinical interviews. They can be both structured and unstructured. They can be stress interviews. Now, there can also be, on the left-hand side, we can see there's personality and cognitive tests, as well as just direct observation of their behavior. Something that is called experience sampling. That's when people monitor and record their feelings, thoughts, behaviors, often several times a day. As well as on the bottom here, self-report questionnaires. Now, neurobiological assessment, that basically refers to what is going on inside the brain. And neurobiological, we use brain imaging techniques like MRI scans, PET scans, SPECT scans, functional MRIs, which assess both brain structure and how the brain is functioning. That is fMRI, which stands for functional MRI. As you can see, I listed brain stimulation too, like stimulating, applying an electrical pulse or a mild current to the brain in order to cause neuronal initiation. I previously mentioned some of the neurobiological assessment techniques, and which refers to brain imaging. So I gave a few examples here. Magnetic resonance imaging uses magnets to create pictures of a brain structure. And then below that is functional MRI or fMRI. that allows measures of both how the brain is structured and how it is functioning. It's based on the measure of blood oxygen level depending on the blood flow in the brain. Another type of imaging technique is called positron emission tomography, also known as a PET scan. And the move is kind of invasive measure of structure and function. It's not quite as precise as we would like it to be, but it has radioactive isotopes injected into the measure of metabolic functioning. So recent advances now allow clinicians and researchers to stimulate regions of the brain non-invasively for research or treatment. For example, transcranial magnetic stimulation or transcranial direct current stimulation. They can both be used to test hypotheses about brain and behavior, relationships, and help identify brain networks that might be responsible for the issue in which we are researching. But we always want to be aware that there might be a little bit of cultural or racial bias in assessing the situation. And so certain measures are developed, for one culture, although they might not be valid or reliable for another. It's not just simply a matter of language translation. There are many factors involved. So some strategies to avoid that bias might be cultural competence training, helps prepare psychologists to work effectively with people from different cultural, racial, and ethnic groups. So we do that by teaching them how to understand the ways that cultures or races or ethnicities may impact the assessment process, but might not necessarily apply to every case. And another part of the training and development we need to be aware of is cultural humility. Is multifaceted and includes having an awareness of one's own culture and biases, recognizing differences, imbalances, and inequities that might occur in clinical contexts, as well as a commitment to continue learning about cultural and racial biases that may impact clinical work. Now this concludes the session for this video. Thank you for joining us.